Imagine living in a rural community that has a shortage of physicians and lacks the resources to run a community health center. You're sick, and the nearest doctor's office is an hour away. They're only open on weekdays, when you're at work. Finding an appointment is a pain. Even if you manage to schedule a time, it can be up to a 3-hour round trip just for a 10-minute checkup. It is easy to see why so many people in rural areas simply don't go to the doctor when they need to.
This problem is a reality across the world. The Association of American Medical Colleges predicts a shortage of up to 31,000 primary care physicians by the year 2025. And this is in the United States alone. As of 2013, 62 million Americans had inadequate primary care access.
And it isn't just patients who are having a tough time. Doctors and nurses often find themselves spending an exorbitant amount of time doing paperwork, sorting through medical records, and entering data. One study found that emergency room doctors are only able to spend 28% of their time with patients. Another study found that family practice physicians spend 48 minutes a day on average just entering clinical data.
Seemingly obvious proposals like training more physicians or reforming national healthcare fail to provide a valid solution. Training a doctor takes several years, so the only way to solve the primary care shortage by 2025 is to start training tens of thousands of physicians right now. This is impractical and just won't work. Alternatively, simply giving people insurance may not work either, as this does not address the fundamental problems of lack of access, stigma, and clinical inefficiencies.
Our solution, the RAD kiosk, will solve the problem posed by primary care shortage by dramatically increasing the efficiency of primary care delivery. Instead of having patients come to a doctor's office, we will bring the doctor's office to the patient by planting kiosks in pharmacies and large stores. Patients will not need to go out of their daily routine to get a health checkup, and they can pick up their medicine from the store as soon as they're diagnosed.
Our kiosk software enables doctors to interact with patients in a more efficient manner, minimizing the time in between visits. Secondly, we address the stigma surrounding visits by increasing patient confidentiality. The kiosk will be a closed-off area, and the patient will have their privacy as the utmost concern. Furthermore, visits will be more efficient, as we don't have to wait for doctors to do the paperwork, but instead we can take care of it immediately with electronic medical records. We make primary care visits more productive for both patients and doctors, and make it easier for the patients, especially hard-hit rural patients, to access healthcare. In these ways, RADHealth presents an innovative solution to the important and pressing problems in America's healthcare. Thank you for watching.